Is PRP right option for my hair loss? Thinning of hair in front, 26-year-old male. I am a 26-year-old male suffering from hair loss. I checked with a leading dermatologist in Chennai and was advised I am not good for hair transplant. She suggested PRP will work for me. Any side effects of PRP? Please let us know with your reviews and answers. Please find my attached pictures of scalp where I have applied oil. Please suggest the best treatment for me to restore, regrow hair. I don't want to try minoxidil or Propecia as they have severe side effects. Please help. Is it telogen effluvium?
Thank you for your question. You submitted several photos and you stated in your question that you're a 26-year-old male, you went to see a leading dermatologist who told you that based on your hair loss that you're not a good candidate for transplant but recommended PRP. And you also state in your question that you don't want to take finasteride or minoxidil because of the side effects. And now you're asking about PRP. Well, I can certainly give you my perspective. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. Hair loss treatment has been a big part of my practice. In fact, we were doing several transplants a week for many years, and I'm the founder of Tricostem Hair Regeneration Centers, a system that I developed in our practice of non-surgical hair loss treatment, which it does include the use of platelet-rich plasma. So I'd like to give you my perspective, and in no way am I being critical of your doctor's recommendation about PRP. In my practice, I use platelet-rich plasma a lot for a lot of indications. I use it for under-eye dark circles. I use it for acne scars. I use it for scar revisions. I use it for skin complexion improvement. We love platelet-rich plasma in our practice and we use it a lot. However, in my experience, and this is coming from not only our own use of platelet-rich plasma for hair loss, but for patients who come to us for hair regeneration, which is our treatment, who have had platelet-rich plasma done elsewhere. Well, let's begin with, first of all, your hair loss situation. It is, even though you're asking, is this telogen effluvium, I would suspect that the dermatologist who saw you diagnosed you with male pattern hair loss. And although you are probably under a lot of stress and you are probably experiencing telogen effluvium, understand that telogen effluvium is a temporary condition where your hair does grow back after the stress is over. But from the photos you submitted and from your history, it appears that you have male pattern hair loss. So understanding that there are different mechanisms and very few that we truly understand responsible for male pattern hair loss, you've essentially eliminated, by not taking finasteride, the option of using something that is shown to help 60% of men. You called finasteride, using finasteride as a DHT blocker or dihydrotestosterone. You limit your options, but I can tell you that what we've done in our practice, and you can learn more about this, is we were using a material called acellular matrix, combining it with platelet-rich plasma with the intention of helping people with hair loss during hair transplantation. The challenge has always been getting the hair grafts to heal and grow in a way that's more consistent and maximal, in addition to help the donor area where we harvest the grafts to heal better. Well, a wonderful side effect was that thinning hair appeared to get thicker. So I spent a few years developing a system and process where we've actually, instead of doing a hair transplant, do the hair regeneration injection. Now, platelet-rich plasma is part of this injection, but it's not the only part. So if someone like yourself comes to our practice, we actually recommend hair regeneration treatment as a first-line treatment. We're able to, with hair regeneration, stop the progression of hair loss, reactivate hair that is not growing, and get thinning hair to start growing thicker. It fills a remarkable void in between the two areas of limited treatment, which is essentially pills and minoxidil, finasteride and minoxidil, and surgery. And your dermatologist, I would agree with, because diffuse hair loss is very difficult to manage with transplant, because there isn't an area that you won't be losing hair as a side effect of the transplant. In addition, a young man in the 20s with a fairly aggressive progression is not going to have enough hair from a transplant to create the volume that you want. So we've been very, very fortunate to be able to do this treatment, and we have patients who come from around the world who benefit from from this hair regeneration treatment. And I developed the company Tricostem to be able to bring this treatment to outside of our 2 offices in Manhattan and Long Island. So I would suggest you learn more about this combination treatment. I don't feel that PRP alone is effective enough. It may stimulate hair growth, but it will not stop progression. And we've been able to show from hundreds and hundreds of patients for many years of doing this that we're able to stop progression and restart growth of hair that is salvageable. I always say that the earlier we catch somebody, the better it is, because there's more hair to save. If someone's lost hair, and a general rule of thumb is if an area of skin is smooth for 5 years or more, then it's not likely that we're going to be able to treat that area. So if someone comes to me who's very shiny bald, they're not a good candidate for hair regeneration. But if someone has hair thinning, men and women, for men, more than 99% of men respond favorably and see improvement. And for women, more than 90% respond to hair regeneration. So understanding that, learn more about these options of PRP and then the combination treatment that we do with PRP, and see if you're able to access a treatment for you. I understand how difficult it is as a young man. We get so many younger people who come from everywhere. People are applying for visas to have this treatment, and it's been very, very effective. So learn more, and hopefully you'll be able to do something to treat your hair loss. So I hope that was helpful. I wish you the best of luck. Thank you for your question.